Totalitarianism. We cannot wait until this program of dehumanization is fully in place. It must be stopped now to preserve a free and healthy society for our children. It is in this context that I discuss health care. No issue has more fervently caught the attention of the public in recent weeks. Perhaps it is because the issue reminds us of our humanity, our mortality. After all, we all get sick. We have personal problems that bring us into contact with healthcare. We share the most personal parts of our lives with our physicians in the privacy of a trusting relationship. It's for these reasons that people are so passionate about healthcare. It deeply affects all of us. Therefore, the debates are often heated. The left accuses the right of being heartless and not caring for the poor. The right accuses the left of being freedom-destroying communists. But I know many on the left who are some of the most compassionate human beings that I've ever met. They are driven to government out of their love for people because it pains them to see their fellow human beings suffering under the current system. They should be respected for their humanitarianism. I also know many on the right who care equally deeply about people. They know that it is the free market that has lifted the standard of living to unimaginable levels for billions of people. Yeah. Well, it's the Soviet-style socialist system that has brought poverty and misery. Yeah. The right should be equally respected for this view. I believe that it is from this common ground of the desire to help our fellow human beings that we as free-thinking people can have a rational dialogue about how to best care for each other. Whatever your beliefs are about health care, I invite you to consider this speech not as a lecture from someone who has it all figured out, because I certainly don't. See it as the beginning of a discussion with someone who is passionate about caring for other people and passionate about the cause of freedom. Whatever happens politically, doctors from Washington will not magically appear to take care of us. We as a people will have to take care of ourselves, and we are certainly capable of taking care of ourselves. Now, in this debate, the words health, healthcare, and health insurance are often used interchangeably. I define health as a state of complete physical, mental, and social well-being, and not merely the absence of disease. Looking at health in this complete way, it's clear that many factors affect our health. Nutrition, exercise, education, emotional security, the environment, public safety, all of these issues are intimately connected to our health. Consider the leading causes of mortality in this country: heart disease, stroke, lung cancer, homicide, suicide, accidents. All are impacted more by these other factors of health than by any health care we receive. So health is much bigger than health care. And health care is also a lot bigger than insurance. Insurance typically provides relatively inexpensive coverage in the event that something catastrophic happens. Now imagine if your car insurance worked like health insurance. Every time you needed an oil change, engine work, or gas, you'd show your car insurance card and you'd expect it to be free. Such a system is possible, but can you imagine how much the car insurance would cost? It might cost as much as health insurance. Of course, we would not call that program car insurance. We would call it a comprehensive prepaid car care plan. The issue is the same with health care. It's prepaid health care when we have health insurance. Now, people will argue that health care is necessary and oil changes are not. Therefore, we need insurance to protect us and make sure we have access to health care. So I guess you will all have to go out and get yourself some food insurance, because God knows we need food. Imagine if you had a $15 copay for your next grocery store visit. I bet you would buy a lot more than you needed. Perhaps 10 or 15 organic grass-fed T-bone steaks. So you get to the checkout line, and instead of paying for your groceries, you pull out your grocery insurance card. Imagine the bureaucracy of paper pushers needed to handle a system of millions of people's grocery insurance. Claims managers, coding specialists, billing experts, a whole industry would develop to manage it. Hundreds of thousands of people, and it would all be pointless. Imagine people could just pay for their own groceries. issue is the same in medicine. People can pay for their own care and then have catastrophic coverage for that unexpected accident or major diagnosis. Insurance is one of the worst ways to pay for just about anything. So we can see that healthcare is one important aspect of our overall health. And health insurance is just one inefficient method of paying for health care. The goal, then, of any reform should be to improve access to health care and improve the quality of health care in the context of our other social priorities. It should not be to simply increase access to insurance. So what reform do we really need? The primary problem in health care is the skyrocketing price. The high cost limits access, which drives people to the government to save them from rising prices. But it's the government that creates the high prices in the first place by limiting competition. The answer does not come from more government, but from less. The only system that creates lower prices and higher quality is the free market. We must use the same forces that create lower prices and higher quality in every other area of our lives to create lower health care costs and increase access and quality for those who so desperately need it. We could do this by ending the current system of third-party payers. Under this system, those responsible for paying the bills compete over who can most effectively shift the bill to someone else. In a market system where the consumer is in charge, the providers of health care, the doctors, compete over providing the best value to their patients. Look at where the market is allowed to function. Plastic surgery and LASIK. Prices are down, quality goes up. Doctors work to please their customers. They even give out their home phone and email. Does your doctor do that? True reform would also include tort reform. Imagine... When we eliminate the frivolous lawsuits and allow doctors to move away from practicing defensive medicine, where they have to order every single expensive test to make sure they don't get sued, that would be true reform. Unfortunately, H.R. 3200 has none of these reforms in it. This bill only serves to solidify the current failed system. Now, I will only say two things about H.R. 3200. The first is that physicians are already afraid to provide charity care for risk of being charged with Medicare fraud. You see, if a doctor charges the government for seeing a patient, but then sees another patient for free because that patient can't pay, they could be accused of charging the government more than others. H.R. 3200 expands this by forcing doctors to operate within the government system. Now, although few legislators have read the bill, I have been trying to make my way through the 1,300 plus pages.